The United States Healthcare System by Team 6, narrated by Melissa and Adony.
In this presentation, we will explore the many factors that shape the United States healthcare system, such as the history and values, key legislation acts, Medicare and Medicaid, employer-based healthcare, HIPAA, and high-tech. It is important to know and understand these factors so that future improvements in U.S. healthcare can be made.
The need for a form of national health insurance in America was inspired in 1916 by the healthcare systems established in Europe. However, many Americans at that time were not too keen on the idea of reliance on government aid because it conflicted with the value of individual liberty. Therefore, the government had the challenge of coming up with a program that would be difficult for opponents to attack while picking up critical support. The elderly and low income seemed like perfect candidates because it was difficult for them to obtain private health insurance because of the cost and inaccessibility due to pre-existing conditions. Also, it was viewed that in order to have a secure retirement, having health insurance was important. Finally, upon reaching public approval in 1965, President Lyndon B. Johnson signed in Medicare and Medicaid into Title 18 of the Social Security Act.
Medicare and Medicaid are two key legislative enactments. Medicare is a national health insurance program created to address the needs of the elderly, and Medicaid is a government supplemented insurance program for the low income and disabled.
Medicare is a national health insurance program for the elderly. Eligibility for Medicare starts at 65 years of age, and a person or one spouse must have worked a minimum of 10 years in a Medicare-covered employment. Medicare consists of four parts. Part A is hospital insurance. It covers inpatient hospital care, skilled nursing or rehabilitation, home health care, and hospice care. Part B is supplementary medical insurance. It includes added benefits such as physician services, various therapy, home equipment, and diagnostic testing. Part C consists of managed care plans. Part D are prescription drug plans. Each plan has their own depth of coverage with a list of drugs plus distribution methods. In Part D, the government pays up to 75% of prescription drug costs, between $250 and $2,250. After reaching $2,250, patients must pay out of pocket for prescription drug costs up to $3,600. Only after reaching $3,600 will Part D begin to cover costs again, but at this time at 95%.
Medicare has vastly improved the lives of the elderly because the cost of medical bills has been made bearable and the quality of life for the elderly has been improved, thus extending the life expectancy in the United States. However, Medicare coverage still cannot compete with the employer-based or private health insurance plans because it excludes certain services offered in optometry and dental, which is unfortunate because the elderly especially need to be covered in all areas of medicine.
Medicaid is a public health insurance program that allows low-income families and individuals with disabilities to have viable access to long-term health-related coverage. Eligibility for Medicaid depends on a family or individual's income or benefits, which is calculated with the federal poverty level. That, along with documentation on U.S. citizenship, immigration status, and residency, all have to be presented. Although its initial objective was to cover only certain individuals, changes to expand Medicaid coverage to pregnant women, infants, and children that suffer from poverty did not occur till the late 1980s. The program is funded by both the federal and state governments. Medicaid is monitored by the Centers for Medicaid Services, a federal agency enacted to uphold a set of standards in each state, manage and oversee federal and state health care purchases, thus promoting quality Medicaid management.
With employer-based health insurance, employers may choose to insure employees by a self-funded group health plan or by purchasing fully insured policies. A self-insured group health plan is responsible for paying providers for healthcare services. In most cases, employers lack the infrastructure or experience to pay for healthcare services. In these situations, a third-party administrator, usually an insurance company that sells and administers commercial health policies, is brought in to manage the work of running the group health plan. The group health plan may negotiate rates with healthcare providers similar to the way that commercial health insurance and managed care organizations negotiate payment rates with providers. If an employee chooses to participate in the health plan, typically they would have to pay a premium as well as a copayment or deductible. The Federal Government Act ERISA established uniform national standards for employee benefit plans and that prevent state laws from governing employee health plans. One of the biggest reasons that the ERISA Act was implemented was to establish a national standard for companies who operate in multiple states.
One persistent problem within the government health insurance programs is fraud and abuse, which costs the programs billions of dollars each year. Healthcare fraud is made possible by having successful knowledge of basic data entry on a computer and recruitment of patients. Also, there is a lack of a central system. So, for example, a contractor in Florida cannot see if someone is submitting claims for the same patient in California. Healthcare fraud consists of knowingly billing for services and supplies that were not provided, altering claim forms or receipts to receive a higher payment amount, misusing codes on a claim, charging excessively for services or supplies, and billing for services that were not medically necessary. Although the government has taken measures in order to reduce the amount of fraud and abuse within the system, there is still large amounts of fraud that goes undetected.
With more options available to individuals for healthcare, there is also a growing concern for confidentiality and security for patient information. HIPAA was created in 1996 for this particular reason. It was created specifically to protect patient information with the expansion of electronic medical records. HIPAA also protects patient individualism by allowing individuals to keep their insurance as they are in the process of leaving their job. HIPAA is supported by the HITECH Act. The HITECH Act was enacted as a part of the American Recovery and Reinvestment Act of 2009. This act was created with a focal point to expand and synchronize modern technology with the healthcare field. New technology may be available to help doctors and other healthcare professionals stay updated with changes and advancements in the health field. With the enforcement of the HITECH Act and HIPAA, the quality and efficiency of healthcare can be improved while ensuring the security of patient confidentiality.
In conclusion, healthcare reform has reached milestones throughout the years. However, healthcare in the United States is still an imperfect system. Despite programs such as Medicare and Medicaid and protection acts such as HIPAA and HITECH, millions still go uninsured or cannot get adequate insurance coverage for particular services. This is due to the United States' continued choice to reject a universal health insurance program, which is in part due to our value of keeping our individual liberties. Until we reach a universal health plan, government focus should be placed on improving the quality of Medicare and Medicaid, as well as weeding out fraud and abuse within the system, which will save the government healthcare programs billions of dollars. Thank you for listening to our presentation. Hope you enjoyed learning about the United States healthcare system. Like, comment, and subscribe. Be sure to check out Project 2, coming soon.